she looks fantastic. But this extra skin doesn't necessarily go away.
Right when I first got the surgery, it looked good. Kind of blows my mind that every month that goes by just gets better and better.
Everybody, we're here. We're about to do the markings now. You can see if you come in really closely, you can see this extra skin. Okay, she looks fantastic. She's got a great figure, but this extra skin doesn't necessarily go away. I wish we had a little injection that just made it shrink up, but we don't. The main thing that we can do that we know that works really well is a tummy tuck. So all of the skin basically from here is going to be pulled down to here, and it's going to look awesome. My main markings are going to be where I'm going to make my first incision. I'm going to keep it pretty narrow, and then I need to spend a lot of time on the belly button. I do that inside surgery, and we need to do that hernia repair. We're also going to do a little bit of liposuction. So what that looks like is it kind of like cinches in here on the side, really rejuvenated. So stay tuned. So we're on to the liposuction portion, and we're removing fat here, especially from the love handles in the back area, so the waist cinch in. So we cinch in the waist also with the plication, but the lipo is that extra touch that really looks nice. Umbilical hernia, very common. If this is something you have, you do want to get it checked out by a doctor. If you happen to need a tummy tuck at the same time, you could get them fixed at the same time by a plastic surgeon. Problem with umbilical hernia, it distorts the belly button, it looks a little bubbly, and it could have problematic structures poking through. Okay, the problem is if it gets stuck, it could cause a medical emergency, so it's something you don't want to sit on for too long. You do want to probably try to get it fixed at some point. It'll also make the belly button look better. So we did that for our patient here. She lost 60 pounds after her pregnancy. She did that all on her own, and then we removed all of that extra skin. You can see no amount of diet and exercise gets rid of that much skin. Really spent a lot of time in this operation to make it look like, you know, you haven't had surgery. So we spent a lot of time in the belly button, which is actually super hard when you have an umbilical hernia as well. And then we keep that incision super low so that even if the scar looks fat, which it won't, it'll be hidden in that bikini line. That's it for our patient. She's gonna feel a little bit sore the first couple days. We did that Exparel. Make sure you ask your doctor for that. Generally speaking, around 2 weeks, people start to feel pretty good, and then full recovery is about 6 weeks. Interested in this procedure, check out our website, drdanielbarrett.com, and fill out a virtual consultation if you are at all interested in getting this done to find out more information. Thank you so much.
But today's 10 days post-op for me. I'm feeling good. Posture check. I am not wearing compression. My surgeon doesn't have you start doing that until 2 weeks post-op, and for me that's literally been the biggest blessing ever because I feel like I've been able to stay really comfortable. I don't have anything rubbing on my incision. I have like good blood flow going back and forth. I'll start wearing compression at the 2-week mark, but thus far in my healing journey, I've been really happy that I've been able to do without and just kind of like be comfortable, be getting good sleep, be getting good blood flow, good rest. It's looking really good. It's healing really well. I was just so freaking terrified before, and it hasn't been as bad as I thought. So, thank you. Today I am 14 days post-op. I cannot believe I'm already 2 weeks out, but I am so close to standing up straight. There's the side. You can see that the swelling has definitely gotten down, and I'm still feeling really good. The rest of my stitches will actually come out tomorrow, and then I will be starting compression. So I'm 26 days post-op today. I am in a binder. I just took it off so that I could show. I definitely have some swelling. So my skin is kind of wrinkled because I wear silicone tape. So these are just wrinkles from that, but that thin little line is the incision. That's what I'm looking like these days. Not too shabby. Just realized I'm 3 months post-op today, so here's the lowdown on how I'm feeling. So as of right now, I literally feel nothing. I feel totally back to normal. Honestly, it feels like I had nothing done, which is so crazy. I definitely feel a lot better not having the hernia and the diastasis recti. I can lean forward and I don't have a sack of intestines hanging down from my stomach. My incision has healed really well. It closed really quickly. I had a lot of help, and so for the first 6 weeks, I literally did nothing except rest and heal. Yeah, that's kind of where I'm at. So at this point in my process, I feel like it's honestly just like scar maintenance, like helping the appearance of the scar. So I'm still wearing the silicone scar tape and the belly button shaper. That's what it's looking like for me at 3 months post-op.
It's been super smooth. I feel like at this point I've gotten to a really good stage where I'm just kind of coasting along. Even the beginning wasn't as bad as I anticipated. I didn't take any pain medication after the procedure. I took Tylenol, I think like once or twice a day maybe. I felt like tightness, but I would say no pain. It was tight just from the abs being put back together, but no actual pain. So I feel like with the pain management they have in place, it's so doable. And as long as you like have help at home with your kids, it's a no-brainer. Even right when I first got the surgery, it looked good. Even if a month post-op it stayed how it was, I'm like, I would have been happy, but it just kind of blows my mind that like every month that goes by just gets better and better. So I'm just like a normal person, mom of 3. I'm not an influencer. I don't have a social media background. There's a lot of girls that are like me and are realizing that procedures like this, like a tummy tuck, can be medically necessary, and there is medical reasons for why you might need a surgery, and how much this procedure can help just like a normal everyday mom with her life. So it's been super cool just to relate to like a ton of moms out there and help them if they have any questions, just because I'm new to this experience, and so it's been fun to just kind of share my journey. Exercising, sitting up out of bed is way easier, and I didn't even necessarily notice that it was hard before until I got it fixed. Picking up my kids, playing with my kids, if my kids sit on my stomach, I don't have any kind of like lingering uncomfortable feeling like I did before, just because I didn't have any type of like abdominal protection, and now I do. I didn't necessarily have pain before, but now that I've got it fixed, I'm like, it's super eye-opening how much of a difference it's made.
So we are we are, it looks like 6 months. We are 4 months out, you guys, from a beautiful tummy tuck, hernia repair, and liposuction. Okay, she looks great. She's doing everything she's supposed to do. She has our Barrett scar strip. She's using this for her tummy incision. If you want to see that, that looks fantastic. It's still healing. This will go away by more like 12 months completely, but she's doing all the right stuff with these scar strips, and also the Barrett belly button, which helps make the belly button look a little more natural. Anybody who gets a tummy tuck, even if you don't come to me, you could still get that, and you put that right there and it takes care of that, you know? So beautiful, nice 4-month results. Going to keep looking better.